On slide 15, the legislation affects Medicare in quite a few other ways as well, and we don't have time to go into all of them because some features of the law cover complex legal issues that would take another 30 minutes to go over on their own. But breaking down just a few of the additional aspects of the healthcare law, you'll see that effective January 1st of next year, 2011, your claims must include an NPI. That's a National Provider Identification Number. And you can see on slide 19 of this document, you can find out how to get an NPI if you don't have one already. A lot of practices have applied for them. Not all have them, but next year it's going to be very important for everybody. Another feature that's interesting about the new law is that any applicable manufacturer, such as device companies or pharmaceutical companies, must submit a report on March 31st of 2013 and on the 90th day of each year thereafter that includes information regarding transfers of value that they made to covered entities, and that includes physicians. Those types of items might include cash, services, consulting fees, gifts, education, travel, and any other fees. If the covered recipient is a doctor, the manufacturer has to also report that physician's NPI along with the disclosure. The primary areas where physician practices could be vulnerable here is most likely surrounding the anti-kickback law and potentially the Stark self-referral prohibition. Keeping in mind that arrangements with device makers don't automatically make your physician guilty of anything. It's just that the government wants to make sure that the arrangement is, on the level. So that's something to look out for starting then. And then the third thing we've got listed here is that you'll see the legislation expands the Recovery Audit Contractor Program, as we refer to it, the RAC program, and rolls it out into Medicare Parts C and D by the end of this year. The RAC program is already active and in place for Part B, which is primarily what we've been discussing. And any questions about the RAC program, including if you need a list of the RACs and the areas they cover and the open issues, feel free to send me an email. Again, my email address is at the end of this presentation. We've been sort of following the RACs this year in Part B Insider, and I'd be happy to share any of that info with you. I should also add, not on this slide, but the law does also adjust the payment amount for bone density tests. The practices who perform those were very happy to hear this. CMS issued a transmittal just yesterday afternoon on this issue, and it lists the new RVUs that will be in place for codes 77080 and 77082, which are the DEXA scan codes. So the new RVUs have been released for those in the new transmittal. And if you can't find it, I'd be happy to help you locate that transmittal. On slide 16, a lot of practices have asked questions about the implementation timelines for the provisions in the healthcare bill. Some they want to take effect immediately, some they want to wait a while. But in particular, several pay boosts in the bill were retroactive to January 1st of this year. But it's unclear when the fee schedule will actually incorporate those retroactive changes and when the MACs will start paying you based on the higher amounts. I sat in on a CMS call a few weeks ago on April 13th, and Amy Bassano of CMS said that CMS uses a complex calculation to incorporate the payment adjustments into the fee schedule, and she said that it could take a month or two before they all take effect. And then even after CMS releases the new rates, the contractors do extensive testing to make sure they're correct, and that again adds to the timeline, which on that same April 13th call, Stuart Strymer of CMS noted. Slide 17, your staff members are probably wondering who's responsible for making changes to your system. And really the answer is everyone should be aware of it and involved. Some examples are here on this slide. For instance, if your practice chronically submits claims more than 1 year after the date of service, you'll want to talk to your billing department, or if you use a billing outsource company, talk to them about how to make claims processes more efficient so you can meet that 1 year deadline consistently. When it comes to the annual wellness visits, which take effect next year, you'll have to make sure your front and back offices are aware of the fact that these visits are not subject to deductibles or coinsurance. And then the practice manager and the physicians will want to get involved if they don't have an NPI yet, or if they aren't registered using the specialty code that they're practicing as. For example, as we discussed earlier about being enrolled as a primary care or general surgeon, you'll want to make sure that everything's all set in the system for you going forward. Moving on to slide 18, we'll talk about some steps you may want to take now. And I've actually already talked to a few practices who've said that Medicare patients are already asking about the health reform bill. When they come to sign in with the receptionist, they have questions and how is this going to change my coverage? So be ready for those questions. And remember, you won't have all the answers to all the questions Medicare beneficiaries have at this point, because even CMS staff members don't have all the answers yet. But what you can answer, you may want to write up in a document to keep at the front desk, and just to help any beneficiaries, not be nervous and help lead them through it. And like we said on the previous slide, you'll want to tighten up your billing systems or talk to your outsourced company just to make sure that 1-year deadline is met. On slide 19, we list some healthcare reform resources for you, including the entire law. Again, it is 2,393 pages, but it is pretty readable on that website. You can search for terms, jump to certain sections. So you might want to look at that. Then we've got some information on how to determine whether you're in an HPSA, some resources on obtaining an NPI, and then our website and my email address, so you can reach me with any follow-up questions you have to this webinar. And for more practical solutions for staying up to date on the reform bill changes and improving your coding accuracy, check out supercoder.com, the #1 site for code sets, content, and community. For $19.95 a month or $199.95 a year, you could get online lookup of 3 complete code sets, easy accessibility to CMS information, essential compliance tools like CCI check and RVUs, plus plenty of how-to tips and advice in 1 monthly alert in the specialty of your choice. And then on slide 26, just me dancing with my dog because I'm so happy about all the wonderful changes to Medicare, thanks to the new legislation. And thank you to everyone for attending, and I hope you all have a wonderful day.